Hello and welcome back to the channel. You join myself, Dr. James Gill, for a clinical skills adjacent video. Today we're going to have a look at changes that we might see in the hand on an examination. Note, I didn't say we're going to be doing the examination of the hand, but in fact we're going to be looking at changes that we might see during other examinations that become apparent in the hand. Now, when we'll do an examination, for example, respiratory examination, in OSCE examinations, we will have a series of check boxes that we're looking for students to identify. However, there are things that we might see in the real world that don't directly connect to an examination that we've asked a student to do. An example there being Koilonychia. Now, this isn't technically part of the respiratory examination because its presence doesn't indicate a respiratory problem. However, Koilonychia, which is due to iron deficiency anemia, may therefore be the explanation for why a patient has shortness of breath. So it's something that we may see and actually want to put into our diagnostic sieve, as it were, to work out where we are. However, as you're going to see with many of these clinical signs, Koilonychia on its own may also simply be idiopathic. So we can see it actually in young children who may be born, such as my son, with these spoon-shaped nails. And that really does highlight the name as much as anything. Koilonychia, from the Greek spoon, nychia from nails. And we know, because my son had to have an operation when he was younger, that he doesn't have any issues with iron deficiency anemia, and therefore it's hoped that this is something that he'll grow out of. However, bizarrely, Koilonychia, as well as being due to iron deficiency anemia, can also be associated with other conditions. For example, hemochromatosis, where we've paradoxically got increased levels of iron. It could potentially be due to Raynaud's disease, or may be seen in SLE or lupus. There's lots of things that can explain some of the symptoms we'll see in the hand. So it's very important we don't fixate on this sign means this. A good example of that is clubbing. Now, this is a massive sign that we're going to look for at medical school because it's so spread across different aspects. So with regard to clubbing, it could be due to abdominal causes, it could be due to respiratory causes, it could be due to cardiovascular causes, it could be due to endocrine causes, and also idiopathic. It can be one of those things. So clubbing is where we lose the nail fold angle for whatever reason, and that ends up with a bulbous curvature of the nail. Looks a little bit like a chicken drumstick. And the way we're going to identify that with a patient is get them to put their fingers together like so, looking for a diamond window between the two nails. This is Schamroth window, and if it's present, means that the patient does not have clubbing. Now, I go back to the fact that these are things we may notice in passing on other bits of an examination. We might also notice them out in the real world. As an example, from when I was at medical school, I was in a shop being served by somebody, and I saw that their fingers looked quite visibly clubbed, and I kept on looking at them. And we finished the transaction. I said, "I do hope you don't mind. Your fingers look particularly obvious." And the guy paused and said, "Don't worry about it. I'm very aware of this. I've got clubbing. It's something that runs in my family. We've all been investigated for it. It's idiopathic, but thank you for actually mentioning it. Obviously you were concerned, and thank you for that." So, we've highlighted there that these are things we want to pay attention to, but we're not going to necessarily hinge all of our diagnostic work on that. And I cannot underline that enough with regard to the cause of clubbing. So let's have a look at those now. If we're talking about respiratory problems, we could be dealing with fibrosing alveolitis, lung abscesses or empyema, bronchiectasis, cystic fibrosis, lung cancers. It has a very broad range of things with the respiratory system, which perhaps explains a lot, because we think that this swelling at the nail fold is due to release of vascular endothelial growth factor, i.e. the body releasing a chemical that causes the production or growth of more blood vessels in response to reduced oxygen levels. So it kind of makes sense that it's mainly lung-related conditions, but not always. The next condition group, or next system group, is abdominal problems. So for example, cystic fibrosis, ulcerative colitis, cirrhosis of the liver and celiac disease can all present with clubbing, which in a lot of cases aren't having a massive impact with regard to hypoxia. So with regard to clubbing in the heart, we could have bacterial endocarditis, and we can also have cyanotic congenital heart disease, where the blood vessels have been transposed, ending up with high levels of deoxygenated blood moving around the body, all of which linking to that production of vascular endothelial growth factor. From an endocrine perspective, we can also have a Graves' disease, which can cause clubbing, perhaps due to a proliferation of tissue, because we may also see palmar erythema, a redness to the palm, which can be associated with cirrhosis and can be associated with endocrine issues such as Graves' disease as well. So hopefully you can see with that the connection perhaps with clubbing and perhaps liver issues, and certainly tissue blood vessel production, that there's definitely going to be some overlap with a lot of these signs. With Koilonychia, where we're saying the koilum indicating spoon shaping of the nails, with Onycholysis, we're talking about splitting of the nails as suggested in the name, and there we're dealing with classically psoriasis, but we can have it connected with literal other connective tissue disorders, including SLE, so lupus. It can also be present in sarcoidosis, hyperthyroidism, and crucially, common things being common, trauma. You bang your nail, you get a hematoma under it, you're probably going to have the nail fall off because of that damage, and hopefully it'll regrow. One of the other signs we can see in the hand is kind of looking backwards. If we look at the nails from somebody who's been very unwell or maybe admitted to ITU, we can see Beau's lines, horizontal ridges on the nail where the nail has stopped growing during that time of severe illness. Now I've actually got them on several of my fingers at the moment because I was quite unwell a few months ago with flu. And literally the body says, I'm too busy keeping you alive to worry about making, hair and nails. So those things stop. Hence why it's possible after severe illnesses, people can also lose hair. Now I say it's about looking backwards because these ridges are in the middle of my nail. That means that I've actually recovered and I've had new nail pushing forwards, and eventually, as I cut down my nails, these Beau's lines will disappear. It might be worthwhile asking, if you do see a patient with Beau's lines, what happened? Why do you have these? Do you remember being particularly unwell? Very similar to Onycholysis is pitting of the nails, where it looks like literally somebody's gone at the nail with a small pin. It can also be seen in psoriasis and potentially issues with the hair, because it's the same type of substance, the nails, alopecia areata. And there's a bit of a rheumatological syndrome called Reiter's syndrome, where you have problems with the eyes, problems with the joints, and also problems with the urinary tract infection, which can have pitting as well. So Reiter's often has that medical school aid memoir of the patient can't see, can't pee, can't bend the knee. And in our case, we're also potentially going to see changes to the nail. Splinter hemorrhages are a little bit like clubbing. It's a medical school big condition, and we see these vertical black marks in the nail, like literal splinter hemorrhages that have gone under the nail. So this can be, like a lot of these conditions, to do with trauma. You bang your nail, there's a little bit of bleed under the skin, there's your vertical mark. Now, the reason why we can see those with things like bacterial endocarditis is we get an infection in the heart with the leaflets of the valve. They break off, fly through the circulation and lodge in the end capillary, which we can see underneath the nail. So where that small clot lodges, we get a little bit of death of cells around that now infarction, causing these splinter hemorrhages. We actually see them quite often because literally banging your hand can cause them, these little bleeds. So it's something we can get particularly twitchy about, but in reality are often explained by very unconcerning issues. And particularly with all of these signs, we want to connect them with our history and with other parts of the examination. So if we've got splinter hemorrhages and no issues with fever, no issues with palpitations, no weight loss, no night sweats, no new murmurs, no potential high-risk individuals with regard to endocarditis, we're probably going to say, yeah, that's a clinical sign, I'm paying attention to it, but I'm going to de-emphasize it if it doesn't clearly follow with the evidence that we have. No, not our thinking, but the evidence we have to support what might have explained it. One of the other changes to the nail that we talk about a lot at medical school is leukonychia, so white patches in the nail. I say an awful lot because there are many students who will normally have these little white dots on some of their nails. I don't have any on myself at the moment, but it's not unusual for me. The crucial bit is that is pseudo or partial leukonychia, and these white patches are often due to a little bit of trauma. Now, if you flip it round, proper leukonychia, the whole nail turns white, almost as if somebody's put sort of Tipp-Ex under the tissues there. And this is often normally associated with low protein states. So, for example, renal failure might cause that. I hope this has been a useful overview of some of the things that we might see in the hands. We've very much focused on the nails at this point, but if you perhaps like me to do a volume 2 to dig into the clinical signs that we can see in the hand moving a little bit more proximally, please do put it in the comments and we'll certainly look to do a second video. With that in mind, take care and I'll see you in the next one. Cheerio.